सेहत है तो सब कुछ है.
The growth of cancer curtails the growth of life. That's why cancer continues to be one of the deadliest diseases. Cancer can happen to anyone, anywhere. But one of the recent concerns in the field of cancer is the increasing number of women who are being diagnosed with cancer. The situation is serious and the need of the hour is to detect the alarming signals of cancer at an early stage. To fulfill this need in the area of cancer awareness, we have this show called Patient Education Series on Cancer. This episode focuses on the reasons, various types of cancer in women and precautions to be taken by them. It's a matter of immense pleasure to have Dr. Ganapathi Ramanan, Oncologist, Kumaran's Hospital, Chennai with us. Let's welcome him. Hello doctor, welcome to the show. Doctor, though cancer can hit anyone at any stage of life, but there are types of cancer which develops only in females. So please tell our viewers, which are the most common cancers in women?
The common cancers in women are breast cancer in urban India, cervical cancer in rural India, and then we have ovarian cancer, we have head and neck cancer that is involving the mouth, pharynx, the voice box, and lastly non-Hodgkin's lymphoma, that is cancers arising in the lymph node.
Doctor, what is breast cancer?
Well, cancer arising in the breast is called as breast cancer, and this, like I mentioned, is one of the commonest cancer or the common cancer in urban women in India, and also slowly increasing in its incidence every decade.
How many women get diagnosed with breast cancer every year?
Well, if you look at the statistics, we have to tell per 100,000 women, that is per 1 lakh, the incidence in our country is 20 to 25 women per 100,000 population. That would be the incidence of breast cancer in our country, particularly in South India.
Doctor, is it possible for men also to develop breast cancer?
Yes, but very rare. It is almost 200:1. That means for every 200 women who develop breast cancer, one male is expected to develop the same.
Doctor, what is ovarian cancer?
Well, cancer, like I told, can arise from any organ of the body except the nails and the hair. So cancer which arises in the ovary, that is called as ovarian cancer.
Can it spread to other parts of the body?
Yes, most cancers can spread to other parts of the body, and ovarian cancer also can do the same. It tends to spread to the abdominal cavity, the covering of the abdominal cavity, which is called as peritoneum and omentum, and it also can spread to the lymph nodes, and later it can spread to other distant organs like the lung, etc.
Doctor, are there stages of ovarian cancer? And which is the most severe or advanced stage?
Yes, all cancers have stages, stage 1, 2, 3 and 4. When a cancer is limited to the organ of origin, it is generally called stage 1. When it just goes beyond the organ of origin, it is called stage 2. When it is locally advanced with lymph node involvement, generally it is called stage 3. And when there is widespread disease outside to other organs, it is called as stage 4.
Doctor, how many women get diagnosed with ovarian cancer every year?
Well, the incidence, if you, like I told you, it's number 3 in the list in the commonest cancer which affects women. And if you look at about 100,000 women a lakh, so it will be about 5 per 100,000 women would be diagnosed with ovarian cancer every year.
Doctor, how is ovarian cancer diagnosed and which tests does a patient have to undergo?
Well, initially we should suspect that the lady has ovarian cancer. Conventionally, it has been called as a silent killer, which doctors want to remove this name silent out of it, because actually the ladies are complaining of subtle symptoms for almost 6 months to a year, like lower abdominal cramping pain, urinary frequency, bowel alteration, and some fullness of the abdomen, some dyspeptic symptoms, which commonly is mistaken by the general practitioner as stomach ailment, ulcer disease, etc. or this leads to delay in presentation. Once it is delayed, then it presents with abdominal distension, pain, fluid collection in the abdominal cavity. So this is how ovarian cancer generally presents.
Like, share, subscribe for more such informative videos.